when to fight death and when to give in to it, when to press for a cure or rest content with soothing words and palliative relief. It is also the quality which enables a physician to be able to spot clues which his less fortunate colleagues might have missed. Also, realize the significance of these clues which he picks up from the point of diagnosis, prognosis, management. These clues, believe you me, I need not be esoteric. They're simple, very often simple. But simple only for those who have eyes to see, ears to hear, and hands to feel. It might just be the defeat in the patient's eyes, the agony on his brow, the rattle in his throat, a change in the pulse or the pressure, a change in the pupil, or the persistence of an ominous symptom or an ominous sign, or the occurrence of new symptoms and new signs. Simple. A physician who, with his perceptual abilities, has compassion, has wisdom born of reading and experience, and who also has good clinical judgment, is indeed blessed by the gods. For he has something which no machine can duplicate and no science can invent. He is at the center stage of life where people come to him. He's blessed. He helps those, as many as he can. You know, in today's times, physicians are all keen on rewards, distinctions, be that as it may be. If they deserve it, well and good. But as my friend and I discussed, what greater reward is there for a physician to release the clutch of death and replace it with the hope of living? What honor, greater honor than that? And what greater reward than to see the smile on relatives of such a patient who from death or near death comes back to life. I would like to summarize then what the art of medicine is like. Science, of course, rules, but it must never be forgotten that science alone is not as good as when it has an equal mix of the art of medicine. Unfortunately, this is not so, and that I hope changes. A physician who has the art of medicine realizes the importance of compassion, charity, care in a sick individual. Also remember that the art of medicine is all pervasive. It prevails when science cannot be of use, when science has done its utmost but has not helped. Take the example of a patient who is crossing from one world to the next. It is then that the art of medicine comes into play. It is the art of medicine which helps such a patient to cross the line. The art of medicine is being able to pick up an unspoken nuance in a patient's history, to be able to detect subtle signs, the significance of which he can understand, subtle signs which cannot be picked up by any gadget or machine. It is his ability to sift the evidence before him, and give the right answer among so many possible answers to a pertinent question. It is perhaps an intuitive feel for a diagnosis of how he should proceed. The art of medicine is holistic, looking at the mind and the body, not just the body. The art of medicine is the art of healing, not just treating, not even just curing. But it is only when art and science join hands that healing really occurs. A broader engagement between the doctor and the patient gives a more holistic view. It enables the physician to understand and appreciate the unique quality of a human being, so that a sick patient is just not a disease that has to be treated and cured. This holistic view very often clarifies judgment and helps the doctor overcome difficulties in management. It binds the doctor and patient in a mutually trusting relationship, reinforcing an ancient unwritten covenant hallowed by time. Thank you, ladies and gentlemen.
Thank you, sir. Thank you for a valuable and enlightening talk. This comes to the end of the oration. I request Reverend Father Rennie Mundangurian to welcome His Excellence Ma Tony Neelankaval.
So, my dear brothers and sisters, our Tony Pidava is here. He made it. It was not easy for him to arrange to come here. So, in the name of the whole audience, brothers and sisters present here, I wholeheartedly welcome Ma Tony Neelankaval. I invite Dr. Pavin Lal, our principal, to give the token of welcome in the name of the Jubilee family.